Thank you for joining us here today for this webinar that will acquaint you with all that you need to know about the Master of Public Health program here at the DY School of Public Health. To introduce you to our world here and to answer all your doubts in the process, we have with us the Dean of the School of Public Health, Dr. Suma Nair, and a faculty member at our school, Ms. Gopika Sitaram. I am Nidhi Panikar, also faculty here, and I will be moderating this session. To begin with our discussion, I'd like to welcome some insights from Dr. Suma Nair, our Dean, who will take you through the vision of our school and the various aspects of our program. Dr. Suma Nair is a physician scientist trained in preventive medicine and public health, with a special interest in preventive oncology and women's health. Previously, Dr. Nair was the professor and head of the Department of Community Medicine at Kasturba Medical College, Manipal, and Dr. Nair's collaborations with national and international organizations have resulted in improved access to care for vulnerable populations, student exchanges, submission of research grants, and combined publications. Thank you so much, Dr. Suma Nair, for being here. I hand it over to you now.
Hi, Nidhi. Thank you so much, and happy to be here. At the outset, I would like to thank the admission office for helping us organize this, and of course, I'm also happy to have all the prospective students who have collected here to have an idea as to how exactly or what exactly this whole course is about. So welcome to the webinar, which we have been doing a series of this. So this is the second in that series. And hopefully, by the end of this, you will have some idea as to what public health is all about and how it's going to be an appropriate career choice for you. So we've divided this webinar into two parts. So the first part, which we have today, we'll talk about, the nuances of what public health really is all about. And of course, give you an insight into the curriculum that we follow here and some of the community-based activities and field components that is an integral part of the public health program. The second part, which will be done in a week's time, will talk more about the career prospects that public health professional can look out for. So that is how we have structured this, and hopefully this will be a useful session for you. Right. So like I said, this webinar series that we have is essentially to acquaint you with the concept of public health and what really this whole program is about. Okay. Now, it's not, I understand the lay people who may not understand what public health is about. Despite this term being used extensively over the past 2 years during the raging pandemic, I still find people coming up to me and asking me, what exactly do you do? You have a school of public health, but what exactly do you do? So this was something which kind of unnerves me at times, and I feel it's time that we educate people as to what this is, because it's such an important aspect of health for the whole world. So what exactly do you mean by public health? So when you talk about health is typically associated with, going to a doctor or a hospital and getting treated, and falling ill, and, all these things associated with that. But essentially, it talks about that one individual, who goes to a hospital, or maybe one or two people who may go, or people who collected in a hospital. So it typically revolves around that. But public health is not about that one individual. So you remember when a person goes to a hospital or a person is falling ill, the person has, may have a family around him or her, may have a society to which they belong, or, is part of a larger district or a village or a country. So many things that actually make up the, environment around that person. So that's more important. And that's precisely what public health deals with. So it kind of focuses on the larger picture, that would contribute to determining how a person's health is going to be, and thereby trying to see if these things can be addressed, and thereby making sure that the population health is protected and preserved. And so essentially the emphasis on prevention, okay, and control of events that impact health. And it's about looking at the larger picture, so therefore the larger population, and it's not just about an individual or one person. And that's something which we have to remember when we talk about public health. It's population health, it's a community health, and it's not about just one person or one individual. It's about everybody and how that can affect a country's health and so on and so forth. So the focus here would be on various determinants, and that determinants could be environmental factors, it could be social factors, behavioral factors. Everything has indirectly or maybe directly related to health. And these are the determinants or the factors that a public health professional is interested in understanding, and thereby trying to see how best that can be controlled or prevented, so that you can actually take care of the health in a better way. So as you must be aware, there are a lot of public health initiatives that have been there, which actually have proven to have, positive benefits. First and foremost, for example, are the vaccinations. Do you know that, in fact, the COVID vaccination drive was a huge movement in itself, to combat the, after effects of a pandemic, which killed a lot of people as well. But by and large, you also know vaccinations that we give children to prevent vaccine preventable diseases. So this has been going on for a long time. And we know if we have controlled diseases today, a lot of it we owe to vaccinations, which is an important public health initiative. Motor vehicle safety laws, the seat belt that you use and how it can actually protect you from, some of the after effects of road traffic accidents is an important, example of how public health plays a role in protecting health. Clean air, clean water, also all of these things, water and sanitation. The Swachh Bharat Abhiyan is actually an ingenious example of, an example of an ingenious intervention to protecting population health, to making sure that everybody has access to sanitation, and thereby, and as you know, sanitation is an important predictor of, health, and how making sure that everyone has access to it actually can enhance health. So these are ways in which public health really plays a role. And so hopefully this has given you an idea what public health really stands for. So it's not just about an individual's health, it's about the population health and the factors that play a role, and how as as a professional we can take steps to ensure that this kind of practices and measures are put in place to where the final outcome obviously is improved health for all. So the relevance of public health, the pandemic was a watershed moment. So this was a watershed moment when actually people realized the importance of public health, or at least the word became very prominent, right? And it also brought into focus that just being developed or having large hospitals really does not make a difference. Okay, it's about having people's health being taken care of in the larger perspective. So you saw how the grassroots level workers, even ordinary mortals, actually could bring about a change. It was not just about being a doctor or a nurse, etc. So that is the strength of public health. It brings together people, and it gives people the power to take health and be responsible for their own health. And that is how health can be improved. It's not just about giving health the power to somebody else to take care of your health. It's your own responsibility. And how do we make that happen? How do we make people resilient to take care of it is what is the success of public health. And as we know, India really, really requires a lot of public health professionals. And because our system of public health system is still in the nascent stage, we still have a long way to go. And we need to energize the whole public health system if we need to combat another epidemic or another bigger crisis if it ever appears. Or at least to continue with good practices so that people generally stay healthy. So this is why we believe that public health is essential, and that is also the reason why the government has now gone way out and actually put in place a public health cadre. so that within the government also there is a lot of stress on public health being a separate entity, and wherein people will have a lot of opportunity to work towards the betterment of people. So the School of Public Health was established precisely with these intentions, and it was established in the midst of the raging pandemic in 2021. So this is a constituent unit of the DY Patil deemed to be university, which is set in Nerul. The picturesque campus, which is a multidisciplinary campus, which is, has got a whole lot of other institutions like the medical school, the dental school, the architecture school, and the nursing school. So it's a real multidisciplinary campus with a lot of interdisciplinary collaborations happening. And of course, as world-class infrastructure, as you can see, this is the picture of the DY Patil Stadium. So this school is nestled within this picturesque campus. And of course, it's in Navi Mumbai. And we have the school is centered within the Center of Excellence, which is it's a world-class infrastructure, which has been designed by world-class architects, the Norman Foster from the UK. So it has a very excellent infrastructure wherein this whole school is housed. So the vision of the school is to promote and protect population health, and these are some of the dedicated, initiatives that we believe can bring about a change. So essentially to promote health through excellence in public health education, multi and transdisciplinary research, active community engagement, and contribution to public health policy. So this is some of the main missions of the school with which we hope to promote, population health. So the courses that we offer at the school are essentially the graduate program, which is the Master of Public Health, which is a 2-year full-time in-person course. We also have an executive MPH, which we will be starting from this year. But this is essentially for those in practice. So somebody who has been in public health practice or in the government service for at least minimum of 2 years can actually enroll for this, or somebody who is practicing or is already working now and they don't really have time to do the full-time program actually is eligible for this. This is either a 1-year full-time, or if it's a part-time, it's a 2-year part-time program. Here, wherein we may do away with certain components which otherwise you will be doing as a part of the Master of Public Health full 2-year program. We also will be starting the MSc in Biostatistics from the coming year. We also have a lot of certificate courses which we have started. So these are very specified courses which give you certain credits and which can essentially help you with your upskilling. And these are some of the areas which we believe is crucial for you when you start looking for job opportunities once you're done with the actual program per se. We also have a PhD opening. We essentially do it in the area of epidemiology and public health, are the 2 areas wherein someone can enroll for a PhD program. So the 3 pillars of the school is based on this. One is excellence in education. So we have put together a curriculum which is internationally accepted, and it's multi and interdisciplinary in nature as mandated by the National Education Policy. Technology enabled. All our classrooms are smart classrooms, and also we have a learning management system through which students can have access to real-time sessions and interactive sessions, so on and so forth. And of course, the word integrated learning program, wherein we give them real-time field experience while having access to high quality theory, discussions, etc. We also believe that impactful research is essential to making a good public health professional. So this program mandates that you actually carry out one research project during the course of 2 years. And mostly these projects are, targeting the high priority sustainable development goals. And mostly they are community based. And usually we see to it that they have some social relevance when they are actually carrying out the research. We also believe in collaborations and grants, and we do have ongoing grants. I'll just briefly tell you a bit about it, and publishing in top quality journals. And that is some of the outcomes we expect from the research projects that's being carried out. Community engagement, our 3rd pillar, which we feel is very, very important. So we partner with government agencies and NGOs So this gives us an opportunity to, engage with the community, create awareness programs in the community, make them understand about the importance of public health, and also partner with NGOs, etc. So carry out and give services wherein required, and also carrying out niche research, projects. So all these are some of the aspects that is made possible through the community engagement. So these are the core areas that we deal with. So epidemiology is an important, so these are the main core subjects that everybody has to take. And this is spread across the 3 semesters. The first 3 semesters are primarily for these core subjects. And of course, some of them will be like an elective. So epidemiology, biostatistics, environment and health, social and behavioral sciences, health systems, policy and management, and um, demography and population health are some of the important areas that we uh, uh, deal with. And within this, we have smaller modules and areas which also needs to be, credited for. And some of these are important and they are mandatory, and some may be taken as an elective module. But these will be discussed and described as and when you come. And depending on a person's background and interest, we also look at which could be a better fit for them, and thereby customize it to their requirement, which will help them to get, placement opportunities and furthering of their career goals. We do have, meaningful collaborations. So we are part of a public health consortium with 5 other schools. Indian Ministry of Public Health, Gandhinagar, AIMS, Jodhpur, Datta Mega Institute, and Paral University, wherein we have formed a collaboration. We're also part of a global cancer consortium, which was set up with the University of Kentucky, Mahe, and Tata Memorial Center. So these are some of the consortiums which we are a part of, and through this, there are a lot of opportunities, internships and other opportunities which come our way, and thereby the students also get benefited with that. We also have partnerships with certain reputed schools in India and abroad. One of our important partners is the McGill University from Canada, wherein we have collaborative, research projects which we are doing with them, and also we have, student exchange opportunities through this. University of Aberdeen at Scotland is another partner, and Tata Memorial Center at Mumbai, and Indian Institute of Public Health, Gandhinagar. So some of the very frequently partnered institutions with whom we carry out meaningful collaborations. We have 2 ongoing projects in the area of digital health. One is usability and feasibility of a wearable device to improve sexual and reproductive health among young population, and the other is rapid multiplex screening of sexually transmitted infections at risk population. So this is some of the 2 projects which are ongoing at this point in time. The student profile who take up the MPH program varies this way. A considerable number of them are from the medical and dental background. And of course, other health, like homeopathy and Ayurvedic sciences, etc. So they form a significant number of people who take up MPH for furthering their, career. We also have a reasonable amount of people who come from the social sciences and humanities background and the commerce. And then, of course, a significant number from with sciences at their bachelor's degree. It could be microbiology, pharmacy, basic sciences. So the list is endless. So we do have a lot of different students from varying backgrounds, and that's precisely what makes it so interesting. We draw from the expertise of various disciplines, and that is the most interesting part of public health. It's not just about one subject or one area. Just as health is such a heterogeneous component. So public health, naturally derives itself and derives its expertise from various disciplines. So it's a coming together of so many areas, and that's the reason why having a class which is so varied in nature makes it all the more enriching and interesting in experience. So they truly have a lot of good time talking, debating, and so on and so forth. This is just to show you on the right-hand side the various organizations wherein our students are currently interning. We have NGOs like Sneha, IIPH Gandhinagar. We have with the government NHM. Then they have been some of them are Niti Aayog. So a lot of organizations with wherein we have tie-ups, and our students are interning currently. And of course, these have the opportunity for converting into a placement. So this is something which is very heartening and something which has been pretty encouraging for us and for our students. So to finally conclude, we have these are some of our enabling foundations. One is we have qualified and motivated faculty. So in addition to full-time faculty, we have a lot of reputed faculty from across the border and from within the country who actually are part of the school as adjunct faculty. So we do give a lot of varied information from varied disciplines purely because of this good mixture of faculty that we have. The infrastructure is out of the world. We have excellent infrastructure in terms of classrooms, in terms of libraries, in terms of everything that's required to make this program a success. And of course, a very strong management support, which ensures that the everything that's taken care of and the students have really have a very enriching time when they spend within the confines of this school and the university. So I'll leave you there. So this is essentially to give you an insight into the program and what you have, what is there in store for you. And of course, I could take any queries later once Gopika is done with her talk. Thank you, and over to you, Nidhi.
Thank you so much, Dr. Nair. So that was about the program itself. I now welcome Ms. Gopika Sitaram to take us through some of the community events and experiences that our students have had so far as part of the program. Ms. Gopika Sitaram is a trained social worker in the field of medical and psychiatric social work. She has been part of extensive research activities in the fields of population health, palliative care, and oncology, and she teaches the social sciences and behavioral sciences here at the School of Public Health.
Hello everyone, good afternoon. Thank you Nidhi for introducing me. So I'll be taking you over like in a brief manner through the community outreach and field activities that are being provided here at our school. So let me just share my PPT. Is my PPT visible? Yeah. All right. So community outreach and field activities that we're providing at our school. So what are field activities if you ask? So we are like it's inclusion of experiential learning through a process of experience, reflection, decision making and abstract thinking. So it will actually provide you a chance to apply whatever you're learning in classroom, all the theories that you're learning in classroom onto the field, onto the real world. So it gives you a place to demonstrate whatever you have learned. Right. So the field activities are integrated with every course depending on the nature of the modules. So in every course, there are particular modules available, and in each module, according to that, you'll be having a field activity, and that will actually help you learn those theories better. So why are field activities important in public health, you may ask? So it helps you to build rapport and network with the community leaders, various stakeholders within the community. It also helps you to implement new acquired competencies and also to develop cultural competencies. So various other skills are easily you can easily achieve it through field activities. It also enhances new academic understanding, and most of the time communities will have certain misconceptions all regarding public health, and through field activities you can actually address these misconceptions and these issues. It also provides us a platform for real sense of to gain a real sense of communities. So some of the outreach activities that are being provided for the students here, for MPH students. So first one is a hospital visit. So here you will be looking at the overall functioning of the hospital, to look at the doctor-patient relationship, doctor-nurse relationship. So that will be coming under the hospital sociology module of the course provided here. And also data management system. You'll also be taken to visit a PHC, taluka hospital or a district hospital, and you will be analyzing and studying that area, and then you will have to write a brief report too. So various other departments within the hospitals, such as blood bank, milk bank, even looking at the biomedical waste management, which is a really crucial issue that we have to be looking at through public health. So as a public health expert, you will have to deal with all these units, all these departments within the hospital, try and understand how are they functioning, what is their strengths, what are their weaknesses, and what are the issues that you will have to address, and also the nursing department and even food or canteen too. So in a community, then we also have to visit and evaluate the National Health Program Department. So for instance, district and state TB office or a leprosy society. So during this visit, you will be trying to analyze and study the infrastructure there, the human resources, and then how the program is running at the ground level. Also, various other objectives of the program, you will be analyzing that, and then looking at their strategies, their indicators, and finally even monitor and evaluate the program. So as a public health expert, most of the time you will be getting placed in that area of monitoring and evaluating a certain program. Our students, batch 2 students, actually worked with one of the organizations, CETI, where they work closely in the field of tuberculosis. So these are some kind of opportunities that you will be receiving if you join our school, when you join our school, right? So these experiences will add in or add on to your academic experience too. So when you're doing a community visit, you will be given a family health survey. You will be having to conduct a family health survey. So here you will be looking at what is the type of family, then the number of members present in the family, the source of income, then who all are employed there, who is a breadwinner basically, and then the social economic status, and even look at the history of health and diseases within that family. Also source of water, and even maybe availability of toilet services, and what sort of healthcare facility do they access. All these things would be surveyed by you. And other places, other field visits that you'll be having would be to assess the water purification system, the sewage treatment plant, then the disaster management unit of any particular area. Then you'll also be working, you can also get to work with NGOs, telemedicine center, rehabilitation center, and also cancer institutions. So you can even conduct research work with them, or you can even, as a field aspect, you will be taken by the school to these areas, and you will get an idea as to how these particular aspects are functioning and how it's a public health concern too. So I would like just want to give you a glimpse of the field activities that were conducted so far. So here you have the first one. It's the batch 3 students, that would be your immediate seniors. They observed the World AIDS Day on 1st December last year by performing a street play to promote awareness and educate the community on AIDS prevention. So they performed a Nukkad Natak or street play there. And this is batch 1 students who visited an NGO that works for people living with leprosy. And here we also have a capstone project that's part of your course, where you will have to conduct research. You have to collect data, analyze the data, and finally write a report. So here in this picture, you can see one of the students from batch 2 who is collecting data from a community by interacting, by building a rapport with them, and then interacting and also connecting, networking with the community leader over there, and she's collecting data from them and for her capstone project, which she would later analyze and finally submit a report of the same. Also, as part of their internship, they were they had worked with NGOs and also government institutions. And one of the students from batch one interned with an organization within Mumbai, where she conducted community profiling and their access to government healthcare services in the context of anemia. So this picture is something that she had put in her report that showed her, that was a glimpse of what she was doing throughout her internship. And finally, here our DYPU has initiated a community radio for students. And in that, one of the foreign exchange students from McGill University and a student from batch 2 participated in the community radio, where they interacted with the radio jockey about the courses provided here, about how public health is an important and a really concerning aspect that we have to look into, and also their overall experience at DY Patil University. And the foreign exchange student briefed about their project that they're working on. So yeah, that's all from my end. So these are the kind of field activities and community outreach activities that we are conducting at the school, and this would actually help you enhance whatever you have learned within the class. It will give you a chance to put them into practice before you go into the real world. You will know what exactly has to be done. It's like a trial and error learning opportunity for you. So field activities are something that would be like enthusiastically done by you, so that you can go ahead and become a public health expert in the field. You don't have to worry about, oh no, what will happen now? We are just stranded there. No, you won't have to be stranded, because you will be thorough with whatever learnings you have gained from here because of the field component that we are providing. So that's from my end. We can move on to the next session. Over to you, Nidhi.
Thank you so much, Gopika. Uh, that is all from our end. I'd like to open the session up for any doubts, any questions that any of you have that you would like to ask us on the program, on the school, anything that you would like to know. So please let us know if you'd like to ask us something.
Hello.
You can also put it in the chat box.
Hello. Am I audible?
Yes, yes. Is that Sharad? What?
Yes.
Okay.
Yes.
Yep.
Ma'am, I'm from Gujarat, Bhavnagar.
Right. Oh, hi.
And I'm Dr. Sharad. I'm a working professional. My job experience is more than 3 years.
Okay.
So I want to pursue this course for updation in my job profile, as I am a government employee and I'm an MBBS undergraduate. So
Okay.
for some important posts like district officials of health, Masters in Public Health is prerequisite, either diploma in public health or Masters in Public Health. So exactly what certification and validation of this course, if I do from distance, I cannot join as a regular basis, as I have to do my current job also. So what can I do is I can come there for 2 days in a fortnight or a month. So kindly enlighten the matter, ma'am.
Yes, so this, I think I have shown you that there's an executive MPH program which is specially targeted for people like you. So that's, we totally understand that. So there are a fixed number of hours that you may have to come here. There are contact hours that we will brief you. It needn't be on a very regular every week or something like that. It can be a collective amount, depending on the area that you think you will want to, get little more idea. Like for instance, say biostatistics, you want to have more insight into it, probably you can come and spend that time there. Because rest of the program, what we have done is we have actually recorded and we will be having it. You have an online learning management system, which you will have access to it throughout the time period that you are a student with the school. So that will give you an insight into all this. But yes, you can, there are fixed number of hours you will have to come here, but that again is very flexible and we will give you the opportunity to decide and plan that. And secondly, of course, exams are in person. You will have to come for the exams. So at every semester, there is an end semester exam. So you'll have to come for that. And the final one, wherein you have either, so as a working professional, what we do is, instead of that internship, whatever you're working on is also part of, something which you can present as a reflective journal. And instead of the capstone project, you can either do the capstone project within the area that you're working in, or instead of that could be some initiative that you have taken from your end that also can be given. So there's some of the flexibility that we have provided for working professionals, because we know that you already have certain strengths and we just want to upskill you with certain others so that you can become highly successful in the area that you're going to work in. So does that answer your queries?
Yes, ma'am. And another question is that what exact validation with this executive MPH? Is
It is the same. So it is the same. It's got the same validity. So not to worry about that, because as per the NEP, you can have these online components, provided, of course, you maintain certain amount of live online components, certain amount of
in person?
so there are certain components which we have abided by. And of course, since the exams are all in person and it is validated, so your course is actually a real MPH, which you will anyway get as a full-time as well. Yeah.
So if I do this executive MPH from DY Patil University, Navi Mumbai, or I pursue MPH in person from Indian Institute of Public Health, Gandhinagar, the validation is same.
Yes, it is the same.
Because, ma'am, if you are aware about that, as you are the community medicine faculty,
Yes.
so there are posting of chief district health officers or epidemic medical officers in
Yes.
government, which
Yes.
the prerequisite is MPH, Masters in Public Health.
You will be eligible, not to worry. So this will give you that, we first is we are very strong in our, course delivery and things. So that's nothing, you don't have to worry about it. So we'll ensure that you are really skilled to handle that. And yes, this will be a validated program wherein you can get access. Yes.
Okay. Ma'am, my question number 2 is that that when the curriculum will start?
So the executive MPH is from September. Yeah, this September.
So exam dates roughly?
Hopefully in the first week, but we'll tell you the exact dates. I'm just working out.
Examinations.
So examination is, every the 6th month. So within 5 months. So if it is September, I think it will be sometime in April or March.
Okay.
April. It's like that. Yeah.
Basically, my concern is that is why, because I have some mega projects in November and December.
Okay.
So
no, that we can see that. So there'll be some multiple batches going on. So we can adjust it. Not to worry. So we'll see how best. But we'll give you all those dates well in advance, so you'll be prepared for it. So we give you a calendar right at the beginning, so you'll know exactly when those exams will fall.
Okay. And my final question is that, ma'am, if I want to get more updates before getting admission and before paying fees, and because I have to acknowledge my employers, that
Yes.
Bhavnagar Municipal Corporation, and have to claim a NOC from that I can do this course on an executive basis.
Yes.
How can I connect with management more, or I can come there and have all the documentations done? If can anyone enlighten about that?
Yes, sure. You can talk to us. I think Nidhi and Gopika, they're all part of the school. We'll share with you our email ID and of course our contact number, and you can call us. We'll help you with that.
Okay, ma'am. So please, we are connecting you through one of your sales executive, maybe Rajveer.
Yes.
So if possible,
Rajveer will connect you with us. Not a problem.
Okay. Thank you, ma'am. And it was a great session with both of you, ma'am, and Gopika, ma'am. Thank you.
Thank you so much, Dr. Sharad. Yeah, nice. Hoping to see you as our student.
Sure.
Yeah. Anybody else has any query, or everyone has been enlightened? Or was this a little, not that interesting?
Ma'am, one more suggestion I want to give is that if anything like that possible, that some alumni or some ongoing person, am I from a government background? So anybody pursuing the same course with government background, or there may be someone who can who are coming from private or corporate background, then alumni. So if your representative can connect with actual students, then we can connect more with you, ma'am. So
Perfect.
so
Yes.
like
Yeah.
your team is very well aware about that my kind of people is already there as a student, that
Yes.
there may be some doctors having government job, medical officers, or anybody. So if anything is like that, please connect us, so his or her doubts, which is already cleared, can clear my doubts more, ma'am.
Surely, that's a great point. Maybe we'll bring someone, one of our, one of our students who are currently in the same, maybe in the next session of ours, wherein we talk about career prospects, etc. I think we'll also connect with one of them, and yes, we can help you connect. We do have government officials who are our current students. Some of them from the Maharashtra, BMC, etc., who have joined the program and who are currently enrolled with us, and they'll soon be finishing by this year. Yeah.
My side of benefit is that there some paperwork I should do at my place,
Right.
and he already did that at his place, so he can very well
Help
guide
you
me.
with that.
You should do this type of paperwork at your job place, so there is no issues in future.
So actually, what they have done is they've also applied for a study leave from the government. So they have been provided a study leave for carrying out. That's also one of the options. So wherein I gave them the required letter, and then they have applied for a study leave. So that's also a possibility which sometimes you get. So you can look at all that. I will definitely connect you with those people. Yeah.
But executive, MPH and MPH have the same validation and certification and everything.
Yes, surely. See, as per the NEP, the National Education Policy, the recent ones, the government is very keen that everyone upskill themselves, and so they are able to continue education despite career or whatever may come in their way. So this is one of the ways of doing it. So giving an online program which has got all the rigor of a real time program, but then there are certain like anyone cannot join. I cannot take a very fresh graduate for an online program, because you people have some basic skill which is required for you to be part of it. That's why this is very it's a little rigorous, but has got certain guidelines. Yeah, it is valid.
Thank you, ma'am.
You're welcome. Does any of the others have any queries, or is everything cleared? Dr. Sharad kind of cleared all your queries also, but I thought it was very specific to his area of work and his queries. So I'm sure the others may have some queries, or this isn't very enlightening at all. It can go either way. So please let us know. I can see a lot of names: Daniel, Shubhangi, Nivedita. Anyone? We're quite heartbroken. No one has any query. Gopika? Anna?
Yeah, that's what. Might have some doubts.
Vishruti, I thought Vishruti, I saw them come online and now they're gone. Dr. Zeal. And there's somebody, Vivo, somebody was there who was actually on I think, traveling. Do you have any queries? No one has queries.
Hello.
Yes, Nivedita. Hi.
Good afternoon, ma'am. Hi.
Good afternoon.
Ma'am, can you please tell us who can join the executive course, ma'am?
So, yeah, what's your background, Nivedita?
I'm a homeopathic doctor, ma'am. I have an experience of 6 months only. I have graduated in 2022.
Okay. So we usually, the executive program is for the essentially government and other doctors who are currently practicing and has been practicing for at least for 2 years. For a minimum of 2 years practice and ongoing practice. So essentially it is by and large for, the government officials who it will help to, enhance their skill, and also they get opportunity for promotions and things. So no, you may not be eligible for the executive program. You will have to come for the full time. Yeah.
No problem, ma'am. Thanks.
Because the whole thing about executive is when you are doing online, there has to be certain skills which you already have, for which you need not come on a regular basis. That's the whole point. So that's the reason why there are very certain guidelines as a prerequisite for the executive program.
Okay, ma'am. Thank you.
My pleasure. Anybody else? Gauravi? Rajveer?
Then
Yeah.
what is exactly the criteria for executive
Sorry?
MPH?
So essentially, minimum of 2 years practice, preferably, who is somebody who is currently employed with the government, or even a private practitioner, but who is, wherein this MPH is going to have a certain, upskilling done, which will help them to enhance their current skills and thereby, enhance their career prospects. So that's the thing. But that 2 years of minimum practice and currently being employed and in practice is important.
Okay, thank you, ma'am. चालू करेंगे. Thank you.
Rajveer?
Hello.
Yeah, Rajveer.
Good afternoon.
Good afternoon. So, so those who have a further query, maybe you may connect them to us. You can ask them to connect with either Gopika or Nidhi or Soumya.
Sure, ma'am.
Yeah. And the other thing is, so anybody else has any queries, Rajveer? I mean, are they all, are they interested? What is the seal?
Only Dr. Sharad having the queries.
Yeah.
Yeah. So he just want to know, means he wants to solve the query with you, ma'am, only.
Okay.
Yeah.
Ma'am, there is a question in message box too.
Yeah. From 1st August. The current thing will start from 1st August.
From executive, it is from September.
Yes. This is the full-time one is from 1st August. Executive is September. Yeah, so Gauravi, I think you're talking about the full-time program that will start from the 1st of August. Yeah. Thank you, Dr. Zeal. Where are you from? It will be nice to know something about you all. It's interesting. It will be nice for us to have some idea about all of you.
I'm from Bhavnagar.
Good afternoon, ma'am. I am from Navapur, Maharashtra.
Dr. Sharad, I think it's got kind of frozen. But I think I got some aspect of yours. So thank you so much for enlightening us. Yeah. So we know a lot about you now. Yes. Dr. Zeal, you are from, what doctor are you? Are you practicing or?
No, ma'am, I am fresh up.
Okay. So what you've done?
I have completed with my bachelor's of physiotherapy.
Oh, physiotherapy. Okay. Right. Who is Vivo? Vivo was supposed to open up. I'm sorry, your name is not there. So that's the reason we have call you by the tag which there. So Daniel. Okay. So they don't want us to know. So I think if they are, Gauravi is from Mulund. Okay. So what's your background, Gauravi? You're from which, what is your graduation done in? Oh, okay. We get it.
Hello again, ma'am. I belong from Rajasthan and from district Ajmer.
Oh, okay.
Yes.
Interesting. We'll be happy to have you from. So our current students are also from all over. So we have a lot of students from the Northeast, from Rajasthan, then from, of course, Maharashtra, then from Madhya Pradesh. You know, they're from all over. So it's pretty nice to have people from all over the country. Yeah. So we look forward to having you all. So I think if there are no more queries, oh, okay. Oh, you're from here only, Gauravi, from anesthesia. Okay, so I think you must be knowing Komal. I think so. Komal must be nice. Okay. Yeah. So nice. Oh, good. So then you can join us. So I think if we don't have too many queries, then yeah, I think it would be nice for some of you to join our next session because it will give you an idea as to what are the job, career prospects. We are also having with us one of our adjunct faculty and our advisory board member, someone who has been in this field for very many years. So they will enlighten you about the, public health prospects in India and elsewhere in the world. So we'll be happy to have you. It's on the 14th of June. We'll share the link with all of you. Yeah. So over to Nidhi, you can maybe close it if you think so.
So if there are any other questions, maybe you can contact our admissions office and they will forward your queries to us. And Gopika has also put in our email IDs. So you can mail us your queries if there's any details that you want to know, anything about the program or anything that, if you'd like to visit the school and see the classrooms, maybe all of that is possible. So you can contact us through our email IDs as well. Thank you all again for joining us today. And I really hope that all the information that you got today about our school was helpful for you to prepare yourself for the program here. And we'll be very, very happy to see you here soon. So, yes, thank you. Thank you for being here and see you in our next session, which will be on the career prospects, internships, scope of public health after you leave the program, which will help you decide further on the path that you can take after you join us. So, do join us then. Thank you so much for joining us today.